On this episode of the Big Insurance Connect, I'm joined by my community resource partner, Precious, of Affinity Bridgeway Hospice. We're discussing the ins and outs of palliative care. Let's check it out. It is my pleasure to have Precious here on the Big Insurance Connect so that we can talk about palliative care. Hey, Precious, how you doing?
Hi, I'm doing well. How are you?
I'm doing amazing. Thank you so much. I just wanted to really bring you on today so that we can really touch on palliative care. I just don't believe a lot of people are really in the know about what palliative care is. Precious is representing Affinity Bridgeway Hospice, but hospice and palliative care are different. So could you please just touch on what is palliative care?
Palliative care actually came about, if I'm not mistaken, because I like to be correct, it was a program called the WHO, or an organization called the WHO, which is the World Health Organization. And basically it was created to deal with chronic care management, right? So anything that you're dealing with, like COPD, CHF, you have a cancer diagnosis, but you're not quite ready for hospice, right? They help with the symptom management. So you may not be qualified, may not be ready for hospice, but you can still get that one-on-one care from more than likely a nurse practitioner that is overseen by a doctor, and they'll address, pain crisis issues. They'll address, breathing issues, if you need additional medications and things like that, they'll address that through the palliative care. It's a great supplement to seeing your primary care doctor. A lot of times you'll see patients who are frequently going either into the hospital, they're in emergency room all the time, or they're constantly going to their doctor's office. For numerous of things. We kind of help to bridge that gap and give them additional services, even while they're seeing their primary care doctor.
Okay. So I know you were saying that, some patients are not necessarily qualified for hospice, and palliative care is kind of like an in-between thing. Could you just touch on that? Because I know the stereotype of hospice just means there's no more treatment, really. They're just keeping you comfortable, like the end of life. But this is different. And I know, from some of the things that we have discussed and, taught on, there are some misconceptions about hospice as well.
Well, hospice is not like it used to be. Hospice was the thing, you're going to die, and you got to get on this program because you're dying. But the beautiful thing I think about hospice is the TLC that comes with hospice. With palliative care, you get a little TLC too, because you have somebody who is dealing with you on a more intricate level in your home with what's going on with you. Where hospice, you have the nurse, you have, the caregiver who's coming out, the CNA who's coming out and dealing with you 2 to 3 times a week. You have the chaplain who's dealing with your spiritual and emotional needs. You have the doctor who's continuously looking at what's the best way to help with, your symptom management while you transition comfortably. Now, here's the beautiful thing about TLC, right? We all know that when you get a little love and care, right, you start to feel better. And so the things that you were dealing with, you're probably not dealing with anymore, or they've lessened. And so you come out of that phase where now the doctor's saying 6 months. We've seen people on hospice for 2 years. They come off, they come on, they come off, they come on. And because when you get love, you get the life expectancy. You have people coming in on you, all those great things. And so with hospice, it's a little bit more feels and a little bit more touching on that patient on a regular basis. We're not God. We don't know when your end date is. We're just here to help you, along the way and make sure exactly what it says that you're comfortable. But it's no longer the death sentence. We don't know. We can go by scientific method or what the physicians have seen on a regular basis or hospitalists have seen on a regular basis. This is what happens. You're at this stage. And so within 6 months from now, you probably won't be. But we all know that your transition should be a comfortable one, whether it's a transition that's 2 years or whether it's a transition that's a couple of days. But the beautiful thing about palliative care is that you're probably going to transition, but maybe mentally you're not ready, right? The family is not prepared. It gives, I'll use my company for example, it gives Affinity the ability to come in and get to know you, right? Mm-hmm. Before you even get to that stage, to kind of start talking to you about what that looks like, to bring down the fear of what hospice is and help you to understand where you are and help you to really deal with your healthcare goals. And so that's what palliative care is. It's that in-between stage of showing you kind of what you're going to get, helping you manage your doctor's appointments, having somebody that's coming, that usually with palliative care, it's a once a month visit. But for Affinity, we'll go out as many times as needed to make sure that you're in a comfortable state. And when that transition times happens, we'll be able to be there. You already know us. We already know you. You feel comfortable, and it makes that transition just a little bit easier.
So you're saying because Affinity Bridgeway does palliative care and also has hospice, that it's not like you have to completely change to a new company when and if that time comes for you. You basically can keep some of the same care team, and also they already have the relationship and the records so that you don't have to completely start all over again. Is that correct?
Absolutely. And Affinity has done a really great job at really having grassroots and grounding themselves in the community. So you have social workers that are attached, that are able to bring things to the patient, whether it's helping them, the family start to deal with what end of life care is going to look like. Have you, gotten into making plans about where you're going to be buried? Have you allocated your finances? Maybe there's a change in you being at home. If this happens, is there a skilled nursing facility that's going to take you? So the great thing is that we've already established grassroots within our community and really great partnerships in the community. We can really help drive patient care in the way it needs to go for both the patient and the family, because we can't leave the family out, right? They're still going through their process of understanding what's going on, getting educated. They're going through the grieving process, even though the parent is still alive, but they know that, eventually it's going to happen. So you have the social workers, the chaplains, you have the nurses, you have the hospitalists, you have the staff who's in the office who do a great job at really answering questions for the family and really walking through it. Some of the best relationships are the relationships that we have in office. I have to tell you that. So starting, with hospice, you get all that. And then with palliative care, you're getting that touch as well.
Okay. That's amazing. I love that you really are with them from every step of the way in their journey. Technically, what I meant by too, when I said, you can graduate from hospice, I mean, you can graduate in another way, not necessarily transition into the inevitable, but more or less that you can go back to palliative care. Like if you get way better, and then if something happens, you can go back to hospice. Is that correct?
That is absolutely correct. We never want to leave you. We always know that when you're on hospice, when you're having hands on a regular basis, you're going to do well. Sometimes a minute that you pull out, that's when the person starts to go back on a decline. And Medicare has its guidelines. If the person doesn't meet the criteria for hospice anymore, we do have to pull out. But having palliative care, like you said, it's absolutely correct. You get to transition back to palliative care. We get to follow you. We haven't left your journey. We're still there with you on your journey. And then at that time when you're appropriate for hospice again, or not, what do we know? Then you can go back to hospice. But we're always going to be there as that in-between.
I love that. That's just amazing to know that you really do have additional support by your side, and the family as well is included in those decisions. For, anyone who's just seeing this video and never heard of palliative care before, but, there's some things that were said that says, maybe I need to look into this. How would someone qualified for palliative care?
Pretty much palliative care is on all insurances. Now, each company, so our company, let's talk about Affinity. There are certain insurances that we're able to take and some certain insurances that we're not able to take. But pretty much everybody has access to palliative care. And the great thing is if they don't have access to it on their insurance, they can call you and say, hey, listen,
Exactly.
this I'm trying to do palliative care. Can you look at my insurance? But for the most part, everybody has access to palliative care and hospice. Medicare is the big one. And if you have full coverage Medicaid, I don't want to speak out of turn, but if you have full coverage Medicaid and you qualify for hospice, then 9 times out of 10, you're going to qualify for palliative care under that company. But it is based on, your insurance. And so if that's something that you're like, I'm interested in, or my family is interested in, there's no problem. All you have to do is call the office. If you want to call, me directly, I take calls and I'll get the information together and send it over to our intake team, and they'll go ahead and verify the insurance and see that you qualify.
And just also, I wanted to add, it's definitely a conversation you should be having with your primary care doctor initially, right? Because isn't there an order or something like that has to be put in?
Yes, there's a palliative care order that has to be put in. If you're in the hospital, you can request it, while you're in the hospital, or you can request it from your primary care physician that you would like to get on palliative care. And physicians, to be honest, they love palliative care because they don't necessarily want to have that conversation of end of life care. So a lot of times they would rather introduce you to palliative care and then allow the transition to happen organically.
Got you. I love that we are being such a resource for the community, because until I really met you, I really didn't understand it to this extent. I knew about it just, from insurance and things of that nature, but how deep it gets, and maybe it's just you because you have that touch with people. I mean, just how you care so much. I know there's a couple of clients that we've helped, together collaboratively to try to, get them the very best care that they needed. And, from an insurance standpoint, and also from, their working with their primary care and their internal medicine doctors. It just literally is a collaborative effort. And if you are someone watching this video and that you need it, or if your loved one needs palliative care, or you just want to have the conversation to get a little bit more information, I'm scrolling the information on how to contact Precious down at the bottom of this screen. She's got her phone number there. She does answer the phone. She's a busy lady. So if you don't get her, I think you could leave a message and she sure will call you back. But I really love you for being on today, Precious. I appreciate this information and being a resource for the community. God bless you, because you are literally an angel, my friend. And I thank you for all of the times that we have been out in the community together. I believe this is your passion, and that you are definitely affecting people's lives by what you're doing. So do not change, okay?
Thank you so much, Ms. Moon. The same for you. People don't know what of angel you've been to for me, and dealing with patients that, don't have a primary care doctor because guess what? They didn't have insurance, or their insurance was probably not the best for them at the stage, that they've been in. And so you've been a big help for me as well. But it takes a village, right? To work within the community and bring, especially our seniors, exactly what they need. And a lot of times they're left with no help. And somebody has to fill in the gap. We can talk about it all day. We can pray about it all day, but you have a duty to make sure you're taking care of your people. And some people are called to seniors. And I think that's what we're called to.
Yes, I really love that. We are definitely advocates for our senior community and a resource. So please tap in. I love you guys, and I mean it. Until the next time. See you later. Thank you. If you enjoyed this episode, do me a big favor. Please like, share, and subscribe to the #1 insurance resource that has you covered from the womb to the tomb for all things health and wealth. Until the next time, I love you and I mean it.